Hi, and welcome to Healthy Living. I'm Dr. Donald Pelto, and today we're going to talk about an interesting kind of topic. We're going to talk specifically about foot and nail conditions that affect the skin, kind of the skin and nail and things like that. And we're going to kind of have a show and tell. So what I'd like you to participate with me today is I'm going to show you a few pictures, and these are all common things. You may have it or you may have seen it before, and we're going to kind of have you guess what this problem is that I'm showing you some pictures for. I'll kind of explain it, explain the problem, and then some of the kind of how you can start treating it if you have it. Once again, this is not made to replace medical treatment. This is basically just kind of educational, and it's going to help you learn a little bit more about different foot conditions and problems on the skin. So this first picture here, you're going to see actually three different pictures. Okay, so on the first picture, on the upper left-hand corner, see this kind of little circular problem right up here, and there's a little piece of blood. The reason the blood's there is actually because there was an injection to take this thing out. If you look here on the bottom, there's actually three little dots. They're in different areas, and then this one right here is a big circle here. So can you kind of imagine or kind of think what something like this would be? This tends to be more common in children than adults. It can happen usually on the bottom of the foot, and when it happens in the bottom, the word starts with plantar, and the second word is wart. So what these three things are different manifestations of plantar's warts. So let's explain a little bit of what a plantar wart is. The word plantar means bottom. So the bottom of the foot, it's the plantar surface of the foot, and a wart or a verruca is just the technical name for a wart. And kind of the interesting thing is a wart, it looks like it's right on the skin surface. But actually, if you look at it, it's actually, there's a big, almost like a hub or almost a dune underneath it where it comes from. It's fed and has all these tentacles kind of going into it because the blood supply goes and feeds this wart. And that's why if you look at it kind of head on, there's these little black dots on it. So treatment of plantar's warts, many people before they go to see the doctor, they try maybe some topical, we call it the salicylic acid. That's a topical acid treatment that you put on there. That can sometimes work. People talk about using duct tape as a type of treatment. That works for some people. It's not the duct tape itself, but it's actually putting on the duct tape and ripping it off. Because when you're ripping it off, you're actually causing an aggravation of that skin. And every type of treatment is causing injury, and it's causing aggravation so that your own body would go in there and kind of treat and remove and kind of get rid of the wart on its own. There are also some other types of treatments like freezing sprays. So if you take a spray and freeze it, sometimes at your doctor's office they may have like dry ice or some type of, we call it cryotherapy. That's another option. And then if you start looking on the internet, there's hundreds and hundreds of treatment options for warts. If you can't get rid of it on your own, I recommend seeing someone. Everyone always asks me, is it going to go away on its own? It might go away, but it might take a long time. It might take 6 months, it might take a year, it might take 3 years, and there is a chance of recurrence. The main reason people come and see a doctor is because it kind of spreads, or there's multiple warts in different places, or it's on an area of the foot where it really hurts you. We call that kind of a weight-bearing surface, and that can hurt you. If you sometimes see a really big wart, it's not just a really big one. Many times it's hundreds of warts, and that's called a special name. It's called a mosaic, or a really kind of big wart. What are the three treatments that, as a professional, I find most effective? The three treatments that I find most effective are, number one, laser treatment. The second is cantharidin. And the third is actual removal of the wart. I like to keep it simple. What is laser treatments? Laser is heat. And remember I told you there's little tentacles going into the wart? Well, these little tentacles, the laser is attracted to that color of blood, that red color, and it cauterizes or kind of chars those blood vessels that go into the wart, and it creates kind of like a black blister. And that black blister is kind of popped out about 2 or 3 weeks later, and then you get a much less deep wart. Because as I mentioned before, a wart's very deep. So you get the kind of this first layer or second layer, and then every time you have that treatment. That takes maybe 3 or 4 treatments to do it. The drawback of that type of treatment is it's a little bit painful, especially for that lasering, and a lot of kids just can't tolerate it. The other type of treatment we talked about is called cantharidin, and I kind of caringly call that a Beetlejuice. And what is beetle juice? It actually comes from a beetle, or originally it was made from a beetle. And this beetle, it has a special juice that when you put it on your skin, it causes a big blister. And that blister can be painful, okay? The nice thing about this treatment is that it doesn't hurt to put it on. So if you have a child, you can put it on in the office. It doesn't hurt. They still like the doctor. And then they go home. And then after 3 to 6 hours, you have to wash your foot with soap and water, and it causes a blister. That blister tends to hurt for about a week. If it's a really big blister, you can pop the blister, but leave the cover on it. And then once again, if you imagine creating a blister, that's going to take off a couple layers of skin, and then you're going to have less of a wart down there, and you do that a few treatments, and then eventually it'll go away. I recently had a wart, and I've used a laser, and I've used the Cantharidin. I prefer the Cantharidin because it doesn't hurt like the laser really hurts to do it. And then the third treatment option, let's say you only have one isolated wart and you just kind of want to get rid of it. What I would do for that is then you can just remove it. You can just take the wart away and then it's not there any longer, okay? So that involves cutting out the wart, so you have to numb up the area like I showed you. There was that little red dot, that was the blood from numbing it up. That hurts. You remove it. And it takes anywhere between 2 and 4 weeks, sometimes a little bit longer, for all that skin to heal. So it hurts once, but it's usually one and done. But with any of these treatments, I want to let you know there is a high chance of recurrence. Okay, there's recurrence for that. If you don't want to do any of those, there are some topical medications that can be used, like salicylic acid, like I talked about. And there's a couple of other ones that can be used. We call it off-label. So what does off-label mean? It just means you're using something for something other than what it was actually made or invented for. So for example, there's one medication. It's called 5-fluorouracil. It's actually used for cancer or for skin, to slough off the skin. And if you can imagine sloughing off the skin on the face, you could slough off the skin on the bottom of the foot, and it would help get rid of the wart. So that's one medication. Another one is called Aldera. Aldera is a medication that was made for warts other places on your body, but you can also use it on the foot. A wart is a wart is a wart. It's all the same, but it's just used for a different purpose. Okay, so let's go on to this next picture here. We're going to talk about these. So what are these things? Okay, this thing up on the side, it kind of looks like a wart. If you look over here, there's one big circle, kind of hard skin. Down here, you see some hard skin down here as well. And then this one right here, you see this little circle right here with some hard skin right in the center. Okay, these are kind of all, what are they? What do you think they are? They're kind of on areas where it's rubbing on your skin. They're all on the bottom or on the side of the foot. And the answer is, oh, he moved away. They are calluses. That's what all these things are. They're corns or calluses. And they're in different places of the body. Everyone asks, do I have a corn or do I have a callus? Basically, a corn and a callus are the same thing. Okay? They're all thickness of the skin. The main difference is that a callus is usually on the bottom, right? It's on the bottom, and a corn is usually on the top. And that's the kind of the main difference. So a callus is on the bottom of the foot, a corn is on the top or on the sides of the foot. And how do you treat corns and calluses? There's a lot of different treatments. What I do not recommend using a razor blade to remove your own. I do not recommend that. Some people come in and are all proud that they treat their own. You have to be careful to kind of get down there and do that is very challenging. A lot of people try to use some callus cream. A good cream is a urea-based cream. Urea, U-R-E-A. It's kind of almost like a cream that exfoliates the skin, that can take off some of that hard skin. You've seen some of these pet eggs in different types of things like this. You have to be really careful though, especially if you have diabetes. Okay, you don't want to be using this or any of these callus removers. So for example, callus removers are really a no-no in my opinion, because what is a callus remover? It's acid. So just like we talked about with the wart, you do want to put it on a wart. Now, if you're diabetic, you don't want to put it on your wart. You might not have a wart. It's not very common for older people with diabetes to have warts. It's more likely a callus. So just be careful when you're putting these acids on a callus, because it can go too deep. The acid doesn't know the difference between good and bad skin, so you have to be really careful with something like that. Trimming down the callus is the most effective thing that we do in the office. Also, sometimes if you make a special insert for your shoes called an orthotic, an orthotic is something that really replaces the sock liner in your shoe, and then it takes the pressure off the area and puts it more in your arch or in a different place of the foot. Those all work very effectively. And then finally, if you have a really bad callus, Sometimes you may need to have a surgery. So let's say it's a very prominent bone. For example, if you have a bone that's kind of curved up like this and it's rubbing on the top of your shoes, causing a really bad callus or maybe even causing a wound, that can be treated with a surgical type of a treatment. So calluses can be treated. They should be treated. Who should really have callus care? And for example, calluses are somewhat normal for most people. Calluses aren't a problem. Calluses become worse when you're wearing a tight shoe or at a fashionable event for a little bit. You pay the price. But who really needs to be careful with calluses? It's actually those that have poor circulation and those that have diabetes. If you have poor circulation, a callus could cause a problem, could cause a sore because you can't heal it. If you have diabetes as well, it could cause an ulcer, and that can be a very dangerous thing. So a callus isn't just a callus. We're going to show you some kind of different pictures of bad kind of callus things. So now we're going to go and talk about, let's show you some other pictures right here. These are 4 different pictures. You can see the bottom of the foot here on the upper left-hand corner. All this kind of scaling on the bottom of the foot, this red discoloration right here, a little bit of scaling on the side of the toe, a little bit of scaling on the toe and some redness here, and this redness on the side of the foot. So all of these kind of red things on the side of the foot, kind of scaling. Anyone have an idea what this could be? Well, here's the answer. It's athlete's foot. So even if you're not an athlete, you can get something called athlete's foot, okay? What is athlete's foot? Athlete's foot is a problem. It's a fungal infection that usually happens on the feet, okay? We call it athlete's feet because a lot of times athletes get it because their feet are in a warm, they're in a moist environment, they're always active, and you can get this kind of a infection that's on the skin. Once again, that skin infection, that can then transfer to the nail, so you could develop a fungal toenail in that skin. What's the problem with a skin infection like this fungal infection? It could create a skin infection, like a bacterial infection. That could be a problem, especially if it's between your toes. I always tell people, be really careful. If you have this white, damp stuff between the toes or athlete's foot between the toes, if you get a cut in that and then a bacterial infection, that could really spread very quickly and cause an infection in the skin that's very bad for you. So athlete's foot, how do you treat athlete's foot? Most people, they try the over-the-counter treatments, okay? What are some of the over-the-counter? You can buy some of these name brand athlete's foot creams. They come in, there's different methods, okay? Athlete's foot cream, there's an athlete's foot spray, there's probably different athlete's foot gel. There's a lot of different things for athlete's foot. The main key I find, and reason people don't get better, is that because they don't treat it long enough. I always say you need to treat the athlete's foot until it looks like it's gone, and then about 2 more weeks, because it kind of just lives there and stays there, and it's happy being there. And so a lot of times it can take a long time. If it's not getting better, or if you're having an infection, you may need to go see a foot professional. And you could try another fungal, kind of a prescription fungal treatment option. You sometimes need to be on an oral medication. And sometimes if it's not getting better, you may have to have a skin sample to really make sure it is a fungus, because there's a lot of mimickers. A mimicker is something that kind of looks like athlete's foot, but it really isn't, okay? And if it looks like it is, but it isn't, and it's not getting better, I recommend taking a skin sample, and that's called a biopsy. You're taking a little skin sample. You can either numb up the area and take a couple little punch biopsies or shave some of the skin off and really determine, is that hardened skin? Is that callus, like we talked about before? Is it an athlete's foot? Is it something else that you may have on the foot? And then there are a lot of prescription medications that can be used. Once again, with a fungal infection like on the skin, high chance of recurrence. So even though you treat it, let's say it goes away, it a lot of times comes back. So be careful. And if it does come back, you need to start using the cream again. That's what I say. So keep the cream handy. Try the over-the-counter. I always recommend, and I just see if you're going to be seeing your doctor, you can ask your doctor for a prescription. Why? Because they give you a really big tube, and it's really inexpensive for the generic. Whereas if you go to the pharmacy, they give you a really small tube, and it's very expensive. If you're going to see your doctor anyway, just have them give you the topical antifungal. That's kind of a quick tip. Works really well. And the next thing, we're going to look at something that kind of mimics, okay, once again, a mimicker of athlete's foot. So do you see this person's skin here? Okay, they have kind of this red area right in the middle. You see kind of these white areas. It looks like kind of callus on the bottom. It looks a little kind of discolored right here. You see this foot. And what would this be? I'll tell you, it's not a callus, and it's not athlete's foot. It's something else. And it's actually a skin infection that can happen other places of the body. Any ideas? Well, it is psoriasis. I'm not sure if anyone has heard of psoriasis before, but psoriasis is a skin, kind of an inflammation of the skin that can happen in a lot of different places. It can happen on the face, it can happen on the arms, on the elbows, and sometimes people come in and all they have it is on their feet. And they may say, you know, doctor, I've tried a lot of callus creams, nothing's getting better. I've tried a lot of athlete's foot creams, and nothing's really gotten better. And at that time, what you would do is something like this. If you're not sure, you would take a little sample of skin, a biopsy of the skin, and that'll tell you kind of what it is and how you treat that. And how do you treat, now once again, as a foot specialist, sometimes I treat this infection of the skin, this inflammation of the skin, but I always recommend this person seeing their dermatologist, because a lot of times they can have psoriasis in their scalp and other places, and maybe they are even treated. And a lot of people that have skin conditions like this, you ask them, hey, do you by any chance have a steroid cream at home? Are you using that for anything else? And they said, oh yeah, I have psoriasis and I use it for something else. And that's basically how you treat this. You treat this with a very potent steroid cream, and using it for quite a while. You have to be careful using steroid creams for too long, because sometimes it can thin the skin, but steroid treatment is very effective for this type of a condition. And you can either see your foot specialist or your dermatologist or your primary care, anyone that's kind of treating if you have that type of a foot condition. And next we're going to look at a problem that happens on the toenail. Okay, so if you look at this, this is something that's painful, okay? You can see here the side of the toenail is kind of dug in, it's a little bit red. This is something that's really easy. Everyone should know what this is. This is called an ingrown nail, ingrown toenail. Okay, what is an ingrown toenail? Basically, if you look at a toenail is normally supposed to be nice and straight like this, okay? Kind of growing to the side of the skin. Normally, and as it grows out, it grows fine. Some people have a nail that kind of grows in like this or even like this. And as it grows in more and more, it has a little groove where it rides. And that groove can become painful as you get an ingrown toenail. And sometimes it's only on one side. So for example, it's only on one side and this side's straight. That can be painful. And it's kind of running into the side. And the way you treat this is you numb up the toe and you take out a little section. Before people come in and see the doctor to have that procedure done, a lot of times they do a procedure called a slant back. So they just kind of trim out the edge if they can make it comfortable. This should be treated because you can see there's redness, there's swelling. This has a little bit of infection with it. Normally you do not need an antibiotic. Just by removing that nail, that can make it better. If this constantly happens over and over and over again, what I recommend is someone have a matrixectomy procedure. And you can see these two pictures here. This is an example of a matrixectomy. I know it's kind of a gross picture, sorry about that, on the upper left-hand corner. It's kind of grown into the edge. This is immediately after you have an ingrown toenail. What you do is you actually cut out the sides right there, and you put a medication down there, and that kills the root, and it's a little bit narrow. And then you can see kind of a year after what's happening down here. It's a nice straight edge, so it's not growing anymore. Ingrown toenails are very easy to treat. They're very important to treat. A lot of times what causes an ingrown toenail can be a nail fungus. Like if you have a thickened toenail, basically you have more space being taken up. You could have it from other types of problems as well with an ingrown toenail. We'll talk next about another nail problem. This is an embarrassing problem in the summertime. Okay, so here's some pictures here of something. I wonder what it is. Okay, you can kind of see there's a thickened toenail here, thickened toenail here, like I talked about, ingrown toenail here, and then some of these over here are very thickened. Here's one just on the top. There's some white discoloration on that. Any idea what this is? This is a fungal toenail. So let's talk a little bit about nail fungus. In the summertime, everyone's concerned about it. They want to go to the beach. They're not sure how to treat this. To keep it really simple, there are some topical treatments. People tend to try Vicks, oregano oil, tea tree oil, anything they want topically. They may buy a lot of these other products. I think any topical is about 20% effective, okay? 6 to 20%, not very effective, and you have to use it for about a year. The oral medications I find about 60 to 80% effective, okay? You have to take it for 3 months, sometimes a little bit more, and it's quite effective. You have to do some blood tests prior. There are some laser treatments as an option. That's kind of a newer therapy. And then sometimes if you just want to hide it, you can do like a nail resurfacing treatment where you just kind of put almost like a fake nail on the top of it, and you can do that for the summertime. This is something that can be treated. It's not something that has to be treated. A lot of people just live just fine with this problem. Okay. Here's another nail issue. Okay, let's kind of look at what happened here. See these two pictures here. This one here on top, see it has that kind of those lines, and here has some blood underneath it. Both of these, what do you think they're caused by? These are caused by nail injury or nail trauma. And so basically that line is the area that was hit on this top picture, and this area is where the blood is underneath the nail. Okay, so how do you treat these areas? The one on the top where there's a line, you just let it grow out. As long as it's not detached, as long as it's not painful, you can just kind of let it grow out and snip it. The one on the bottom there where it has the blood underneath there, if the blood is stable and there's no problem, you can leave it there. If the blood causes the nail to detach, what you can do is you can actually remove that detached nail and kind of trim it back. So with a nail trauma, you don't have to do anything, but if it really hurts, you probably should do something. A lot of times with nail trauma, two things can happen. You can develop an ingrown toenail, like we talked about before, or you can develop kind of a thickened, discolored nail. It could develop a fungus or just have kind of an ugly-looking nail, and that's a problem of having some type of a nail trauma because it injures the cells. Now we're going to talk about a problem that can happen on the skin. It looks very similar to that problem we talked about before of callousing. So let's look here. This is actually a picture of the bottom and the tip of someone's toe. So here's the tip right here of a toe, and here's the bottom. Look at all that hard skin down there, and see the cracks. See the crack in the skin right there? And what do you think this is? This isn't just a simple callus. Okay, it's not just someone that has dry skin. What this is eczema. So eczema is kind of a fancy word for an inflammation of the skin. You can have eczema anywhere on the body. It very commonly can caused by rubbing or irritation on the skin, and the treatment is very similar to another condition that we saw called the psoriasis. You would use a very strong steroid cream, and then you also use something else to kind of slow down the turnover of the skin, and that would be kind of like, we call it a vitamin A derivative or a retinoid. And then you can also use a callus cream, a urea-based cream that we also talked about. So you want something to stop the turnover of the skin, you want something to kind of slough off the hard skin, and then you want something to reduce the inflammation on the skin. So this is kind of a unique, a little bit of a different problem. And a lot of people come in, they think, well, I always have calloused feet. And they're not sure that they really have something else that's going on. Now this, on the other hand, is something more common. Okay, you see how there's some cracks? We actually call these cracks little fissures in the skin. Okay, so this I find is a combination of two different things. The one thing is a heel fissure with hyperkeratosis. Hyperkeratosis, hyper means a lot, and keratosis is hardened skin. So hyperkeratosis is hardening of the skin that happens on the bottom of the heel. I find a lot of times people have this, and they also have on top of there an athlete's foot. It's very common to have both of those things. How do you treat it? You give them an athlete's foot cream, you give them a callus cream to slough off the skin, and there are these cute little socks that you can put on. There's a sock that has like a gel, or a sock that you put a cream on and then a gel, and that kind of hydrates things. But you have to get that hard skin off, and that hard skin, the only way to get it off is with your doctor, and they kind of trim off all that hard skin with a razor blade. Okay, we'll talk about something else here now. This is kind of an interesting picture, so a little hard to see here, but this is a red-hot, swollen big toe joint, and this is a red-hot, swollen ankle joint. When you think of red-hot, swollen on the skin, you can either think of infection, or there's one other thing that you can think of that happens in the big toe joint. Any idea? It is gout. Okay? We'll talk a little bit more about gout here. I just dropped my microphone. Okay.
You can just restart from it's gout.
So this red-hot swollen joint is gout, okay? And so when you find something on the foot, it very commonly is gout. So what is gout? Gout is a problem. It's an actual excess buildup of uric acid in the fluid. And one of the biggest places, the most common places, is the big toe joint. It can happen in other joints in the foot, but the most common area is the toe joint. It can happen multiple times. Some people have a big, hot, swollen joint, and it kind of goes away when they take Motrin or ibuprofen. But then it can happen again, and it can happen again. And there are usually two problems with it. Either someone isn't able to get rid of the uric acid, or they produce too much of the uric acid. And when someone has it just once, we give them an anti-inflammatory. Sometimes we can put some medication in the joint that's called a joint injection that really helps them out. But if that doesn't work, you may have to be on a medication. There's different types of medication, your doctor or your rheumatologist. A rheumatologist is a doctor that sees the joints and different joint problems, and they can give you that, and that's very effective. But gout is very painful. The telltale symptom is that even if the sheets fall on that joint, it's going to hurt and be painful. Now we're going to show you some kind of strong images here. I'm going to go through these very quickly, but I think they are important to see. I don't want anyone to miss them. So this first one is an ulcer, and I put the name right up there. It's on the side of the toe. This is actually caused by rubbing on the shoe, and it didn't get better. This has a poor blood flow, and that's going to have a hard time healing. And this other one I want to show you is this is about ready to get an ulcer down here. Do you see what happened? What happens here is there's no big toe because they've already lost that, and all the pressure comes down right here. And this is just waiting to open up as an ulcer down there, and the bone's under there, and that can cause a problem. So how do you treat ulcers? That's kind of a difficult subject because if the problem is circulation, you have to improve the circulation. Many people have diabetes. If the problem is diabetes, you have to control the blood sugar. If the problem is callousing, because they get calluses that develop into ulcers, you have to control the callousing with special shoes, special inserts, and sometimes you even need to be seen in the wound center. A wound center, they are specialists that only treat ulcers. I just wanted to pass over that quickly to show you different types of ulcers. And then we're also going to show you one other picture here of something else. This is kind of a growth. Here's a growth on the side of the foot. Here's a growth at the big toe joint. What happens is it kind of lifts up the skin, and there's something inside of there. It's usually found at a joint region or where there's a tendon passing. Any idea what it is? That is called a ganglion cyst. So what is a ganglion cyst? A ganglion cyst is basically a fluid-filled sac that can either come from a joint or from a tendon sheath. So for example, in your hand you have all these joints where it bends. A joint is where something bends. So anytime you have something that can bend in your body, it can develop a ganglion cyst. On the back of the knee, for example, it can be a Baker's cyst. On the foot, there's a lot of different cysts. And also where there are tendons. So there's tendons. What tendons do is they move the bones and things like that, your fingers up and down in different body parts. Those tendons can have this ganglion sheath that can kind of make a ganglion cyst. So basically it's an outpouching, kind of like a balloon that forms, kind of like a hernia. It forms in the skin, and that can be treated. You can sometimes take out the fluid. That's called aspirating the fluid, or you can inject a cortisone in the area, or sometimes you can remove it. They have a high chance of recurrence, but that's another kind of a skin problem. Here's another skin problem that's kind of different. We see this on a lot of people that have diabetes and circulation problems, so you can see all the discoloration and kind of yellow discoloration, then also up here there's brown discoloration. This is caused because of basically pooling of the blood, and what this is called is venous stasis dermatitis. The biggest problem with this is that this could develop into a sore or a wound, and this is a big problem for people that have poor circulation, they have diabetes, they have a lot of other issues. And basically what happens is the blood flow can go down, but it can't go back up. And so it just stays there. It pools, you get a lot of swelling, that can open up the skin. The first line of treatment for this is to kind of take care of the skin so it doesn't open up, to keep it hydrated with a cream. Compression stockings can help, and other types of treatments can also help. We have another picture here. Guess what this is? See all the sweating that's happening on the foot? This is something a lot of people don't complain of, but it can be a problem for a lot of people. It's called hyperhidrosis. Basically, it's excess sweating, and that can happen on the foot. It can happen underneath the armpits. It can happen other places. This can be treated by your doctor with some really kind of severe type of surgeries and things like that. If it's just on the foot and you sweat a lot, you're more prone to get athlete's foot. More prone to get wart, things like that. You can use an antiperspirant. You can use topical, there's a medication, topical formaldehyde, which is kind of strong, but it's a drying, very potent drying agent. There are a couple of other drying things that you can use. And for our last kind of question or picture of kind of looking at a skin problem, this is something that is on the kind of the lower leg. It kind of looks a little crusty, a little bit elevated. It's in an older patient. I want to end with kind of something to kind of wake people up and just to scare you a little bit. What this is, and it can happen on the foot, it could be black, it could be discolored. This is actually a squamous cell carcinoma. So that is a skin cancer, and that can happen on the foot. People don't think that skin cancer can happen on the foot, but something that kind of looks like a mole or an abnormal mole or kind of a black line on your nail that's new, or something that kind of a crusty thing on the top of your skin, it could be cancer. So you should see your foot specialist for a biopsy, or you should see your dermatologist, or you should see your primary care or someone. So these are kind of just some common skin problems of the foot and ankle. Hope you found it beneficial, and we'll be back to learn more next time.